Thanks also for myself and Hannah for the invitation to take part today, and we really welcome the opportunity to share information about not just our research but the wider context with social care in Scotland. I think particularly at the moment as well, given what has happened during the pandemic and how much more of a sort of public spotlight has been shone on what, despite the fact that many people will at some point avail themselves or know of someone who is accessing social care, still remains somewhat of a mystery out with the kind of specialist third public academic sector focus on it. So Hannah and I are going to talk about a piece of national research that we undertook in 2019, so pre-pandemic, called My Support, My Choice, People's Experiences of Self-Directed Support and Social Care in Scotland. And before I hand over to Hannah, who's going to talk in more detail about the research, I would like to take the opportunity to introduce our organisation a bit more, but also help set the scene with a bit of background information about SDS and social care in Scotland before describing really why we carried out this particular research project. Next slide, please. So the Health and Social Care Alliance Scotland is a national third sector intermediary for a range of health and care organisations. And we have a growing membership of over 3,000 local and national third sector organisations, professional associates working in the statutory and private sectors, and disabled people, people living with long-term conditions and unpaid carers. We do also have many public sector members, including NHS boards and health and social care partnerships and GP practices and community health hubs. We're a registered charity and we have a strategic partnership agreement with the Scottish Government, but we do operate independently. And we also have close working relationships with many national NHS boards, academic institutions, and a range of key organisations spanning health, social care, housing and digital technology. Our vision statement is on the slide, as you can see, and we have three core aims, which are to ensure that people are at the centre, that their voices, expertise and rights drive policy and sit at the heart of design, delivery and improvement of support and services. Our aim is also to support transformational change towards approaches that work with individuals and communities as assets, helping people to stay well, support their human rights, self-manage, co-produce and independent living. And thirdly, to champion and support the third sector as a vital strategic and delivery partner and to foster better cross-sectoral understanding and partnership. Our work spans multiple programmes and work streams, and there's much more information about us available at the hyperlink on the slide, and also we're on a range of social media. So if you don't already follow us, please do at the Twitter handle and the Facebook link and Instagram and everything else there. And as well as working on key elements of health and social care, for example, primary care, digital integration, self-management, mental health, rehabilitation and some condition-specific work, we've got a diverse range of programmes and partnerships related to other sectors, for example, frailty and ageing, social security, storytelling, European and international partnerships. Next slide, please. So now I'd like to turn to look a little bit at social care and self-directed support in general in the Scottish context. Around 250,000 people in Scotland are currently estimated to access social care, and there's an estimated 1.1 million unpaid carers since the pandemic, and the number has grown exponentially during COVID-19. Pre-pandemic estimates were around 800,000 unpaid carers. And as we know, social care is accessed across the lifespan to support people with a wide range of health, physical and age-related conditions, and covers an array of service types, including care in the person's own home, care at home, as we call it up here, care homes, meals and housing support. Scotland's approach to social social care is supposed to be by way of self-directed support, or SDS, which is enshrined in law and guided by national and regional policy. So this law states that people should have choice and control over their SDS if that helps achieve the personal outcomes that they have agreed with a social worker. And SDS is supposed to be available to be used for a wide range of support. For example, assistance going to work, school or college, to buy a specialist equipment, to help with household tasks like shopping, or to pursue leisure activities and short breaks. Although steered by this national law and policy, in practice, SDS is currently delivered through a highly complex, competitive and market-driven local commissioning system, whereby local or integration authorities either directly supply or outsource services, and people buy support from either the public, third or independent sector providers, or employ personal assistants, or sometimes a combination of these. Most adult social care in Scotland is actually delivered by third and independent sector providers, although all services are regulated by the Care Inspectorate, who use quality improvement methodology. At the same time as SDS legislation, we've also seen new law introduced for unpaid carers, the Carers Scotland Act, which is designed to ensure that unpaid carers' rights and needs, including in the context of social care, are met. However, despite some fairly robust law and guidance, there are still some very well-rehearsed issues and problems with the way that SDS, the Carers Act, and social care more generally operates in Scotland. And some of the ongoing problems that people experience include trying to access timely, quality and tailored support in a rights-based, person-centred way. And of course, we all are very well aware of the issues that continue to face the workforce, which is by no coincidence predominantly female, that continues to be undervalued and underpaid. Pre-pandemic, this was actually recognised in Scotland, and after years of campaigning by people with lived experience in the third sector, the Scottish Government had recognised this and introduced a programme to reform adult social care. And the quote on the slide at the top is from this. At the heart of this programme was the recognition that the purpose of social care needs to be fundamentally reframed from being seen as a drain on public resources and a gift from the state to being seen as an investment in Scotland's people, society and the wider economy. And this, of course, speaks very much to the spirit of things like the caring economy and the wellbeing economy models that I'm sure many of you are aware of also. And then the pandemic struck. And this has served, as I've said, not just to exacerbate the many pre-existing inequalities in social care, as well as in our society more generally, but it also did shine much greater public spotlight on the sector's problems. And in response to this, the Scottish Government last year appointed a former Director General, Derek Feely, to head up an independent review of adult social care. And the second quote comes from the report of that review. This review's 53 recommendations are very high level, but touch on some of the most important elements of social care, including fair work, human rights models and ethical commissioning. And there's a commitment by the current Scottish Government to introduce legislation at some point in the coming parliamentary term to introduce a national care service. There may be questions and discussion about this later. Next slide, please. So why did we do this research? Well, the aim was to gain a better understanding of people's experiences and complement the work of other independent evaluations of social care, for example, those that had been carried out by bodies like Audit Scotland and the Care Inspectorate. We wanted to assist strategic planning and delivery for future SDS and social care by highlighting evidence of good practice and where improvements could be made. However, another important reason why we carried out this major national research project about people's experiences of SDS was because there was a data gap here. We were also keen to do this in partnership with others, including people with lived experience, and Hannah is going to talk more to this when I hand over to her. Both we at the Alliance and our partners we've carried out previous research, small-scale studies in 2017, but by 2019 we realised that there was still a gap in national and regional evidence gathering. And while statistical data is being gathered on, for example, the number of people accessing SDS, what they may be using it for, there's a dearth of qualitative evidence about what people's experiences is or are. And even the statistical data gathering is patchy, which means it's still not possible to do intersectional analysis of different people's experiences, depending, for example, on how they identify in terms of their disability or condition, their sex or their gender identity, or their ethnicity. So we've made specific recommendations in the report about the need to really firm up and do much more robust data gathering and intersectional analysis. Our reason for this is basically, otherwise it's just not going to be possible to monitor the successful implementation of any laws, policy or guidance, irrespective of how equality focused and rights-based they are. So that's enough from me, I think. I'd now really like to hand over to Hannah, who's going to describe the research project in more detail, including some of the findings and what we're going to do with the research now. Thanks, Hannah.
Hi, thanks for that intro, Lucy, and thanks also for the invitation to speak today. It's really tempting to sort of discuss the data gaps further. So if that's a discussion that people want to raise in the Q&A, please do, because I could fill the hour with that alone, but I won't, it's fine. If I could get the next slide. So just to give a bit of an introduction to the specifics of the project, this was carried out in partnership with the Alliance and also Self-Directed Support Scotland, which involves a lot of SDSS acronyms, and I do apologise if that causes confusion in the course of this presentation. It was a co-production. It is a co-production project and has been from the outset. So we had a range of self-identified disabled people who were involved as peer researchers, involved in working out the questionnaire, thinking about the sort of key aims of the project, what questions we wanted to ask, and part of the team who were interviewing people and participating in the focus group. So we were really trying to ensure that we were threading through that sort of proper co-production approaches throughout, and it was really useful to see that informing it in the minutiae in the early stages, as well as sort of the wider shape of the project. It's mixed methods, as Lucy mentioned, spanning a survey that was available both in print format and online, a range of interviews across participating local authorities, and a series of focus groups with people from seldom heard from groups. We tried to make that as expansive as possible to try and really target population groups that we knew from those earlier pieces of research we'd done and from wider writing on the subject really weren't known about what their experience of SDS was, and that normally flags some alarm bells, to be honest, because data gaps seldom result in good quality experiences by and large. But yeah, key stakeholders from the beginning were our peer researchers, and we were really grateful for their involvement. If I can move on to the next slide, please. In terms of project development, there's two things that I think is worth flagging in terms of the process. So the first thing we were very keen to do from the outset is work with the local authorities. This is an independent project. They didn't have input on the findings of the research, but we knew that if we wanted to see the results effectively used to implement change in terms of practice and policy and what's actually happening on the ground and affecting people, that means finding key partners in local authorities who are in a position to do that and who in several cases had real willingness and drive and wish to do that. So finding out who those key partners were was really important. And also things from the outset, again, we were trying to advertise this project very early at key national events that both the Alliance and SDSS were running to get feedback from local authority, social work and different partner organisations about the design of it, about the questions that we're asking, and also then to get their buy-in in terms of things like distribution. So I mentioned that we had the print survey in print format, which was really good in terms of having different forms of accessibility, and particularly we heard from older people that a number of them would prefer to have a print survey or available via telephone completion, so we had a free phone helpline. And that was something that without local authority involvement, we couldn't have distributed those print surveys in the same way. Among other things, it means I now know far more about franking than I ever wanted to know, because GDPR constraints mean that we had to have detailed discussions about who was paying for postage and quite how that was managed. So you come out with some unexpected knowledge from these sort of processes. But also as part of this working with the local authorities, we were then keen to, as we produce these fairly substantial reports, so I'm working through, Lucy mentioned we have the national report and a range of thematic reports focused on seldom heard from groups' experiences, but we're also doing some local authority specific reports, which I'm currently in the final write-up stage of. And one of the things we have as part of that is a chapter right at the end where local authority staff members put together a response to the report. Again, don't contribute to the findings or those conclusions, but they can say, for example, our data collection finished in February 2020, so right before the pandemic hit, in Scotland at least, probably. What has changed in that intervening period, and what are they doing? How has that period of change influenced their current strategies, and how is the content of the report going to feed into their strategic plans going forward? So we felt that was a really useful space to let them share that and then hopefully drive that change forward. And we're also arranging a range of feedback sessions in those local authority areas where we've got specific reports with key stakeholders. So that's disabled people, people living with long-term conditions, unpaid carers, people working from across the local authority, not just in social work, but also in connected areas like housing or education or things that cross over functionally speaking with people's experience of social care. And the hope from that is that we're going to get the right people in the digital room, because it's now not in person, to again drive through the practicalities of what this means to get recommendations and how you can change action. We also work with a range of third sector partners, not just SDSS, but a whole range of member organisations and connected organisations for both SDSS and ourselves. Again, involved all stages of the project, and that was really valuable in terms of having those contacts to share, to advertise the project, to appeal for interviewees, and to get that real sense of local context and expertise. Because they know what's happening on the ground in specific areas. You know, someone working up in Kyle of Lochaush knows what the challenges of, rural Highland and Island experiences in a way that me sitting in Glasgow just doesn't. So that was a really valuable part of the process. If I can move on to the next slide, please. I'm not going to have time to go through all of the findings in detail. The national report's 70-odd pages. I'm not going to do that to you, I promise. But what I am going to do is focus on a few sort of key items that speak to that challenge of intersectional data or lack thereof that Lucy highlighted in her introduction. So one of the perhaps unsurprising but nonetheless frustrating findings that we came across is that across a whole range of quite specific questions, we found that women were less likely than men to have been given key information about SDS. So women were less likely to have been told what their budget was for SDS, which made it much harder to make their informed decisions about how they could spend and arrange and organise their care and support. We found that 76% of men had been given that information in comparison to 57% of women. So there's a fair difference there going on. They were less likely to have been given choice of who managed their budget. 65% of men were given free choice of who managed their budget, and saying they were free to choose, while 17% said they weren't. And that compares to women where they were a good 10 percentile difference. Women were also less likely to feel that all of their questions had been answered in needs assessments. So that sort of nuance of making sure that you're comfortable with the process of how social care will be delivered, what it means in terms of other entitlements, all of those kinds of things. So that's just to give the stat there, 57% of men found that their questions had been answered compared to 49% of women. So lots of sort of challenges here in terms of the need to have much more tailored information, tailored efforts to really target groups that you now know are receiving poorer quality of information. We also found that there was a real need for cultural and religious competence. We've got a specific report around Black and minority ethnic people's experiences of SDS. Fairly low numbers, relatively speaking, that respond to the survey. But what they did contribute was incredibly valuable in terms of the nuance and the detail provided. So I've got fewer stats there, but we had people speaking really explicitly about the fact that for most people in that report, none of the 4 options of SDS, the different ways that you can access care, were explained to them, which means that that's not a meaningful autonomous choice if you're not given that information. One person summarised their experience saying, quote, "We didn't have any choice in the matter. We were told it was happening, and that was that." And in particular, Black and minority ethnic people reported a real lack of cultural understanding as a real concern, a real pressing concern. Extreme examples about social workers making assumptions about people's circumstances and ability to access unpaid care based purely on their ethnicity. And in some cases, that was directly linked to a reduction in people's care. So, for example, we had one person talk about a needs assessment where a disabled Black person was asked by their social worker about their personal grooming. Your hair, is it a wig or not, quote unquote? And the person was sufficiently embarrassed by the framing of the question that they said, it's my hair, rather than explaining in further detail. And so the social worker assumed that that meant that their mobility was much higher than had previously been noted on their assessment form, and therefore cut the package. So there's some real communication difficulties and nuance that is having a very distinct impact on people's lives, and notably negatively. And people within this report also really flagged the need for greater engagement with eating and food preparation habits in discussions around support arrangements. So an example, someone saying they were offered a range of dietary choices for the delivery of food to their house, but absolutely none of them were geared towards food commonly eaten by people from their ethnic community, which they found understandably something of a shock and a difficulty. We also had a lot of people saying that when Black and minority ethnic people requested other social care options or challenged decisions, they were labelled very explicitly as troublemakers and had black marks essentially put next to their name on forums. So some really troubling narratives coming out there that really drive a need for greater engagement in that area. We also found real variation around access to SDS around specific disabilities and long-term conditions. And there's a number of reports published around that we've got on our website and our partner organisations' website. Key examples would be that blind and partially sighted people were less likely to be happy with the conversations they had with social workers around their support than the wider representative of My Support, My Choice respondents, with 45% people who are blind or partially sighted saying that they were happy versus 56% as the wider average, and really struggling to access accessible information, braille, large print, etc., even after repeat requests in some cases. And that sort of also had some variation across different areas, but we also found that people with learning difficulties, disabilities, also had difficulty accessing easy read documentations, both as a general default on websites, but also in terms of specific requests. I'm not signing a contract unless I understand it, sort of stuff, which again, perfectly reasonable requests. And in some cases, social work departments just not being properly resourced to provide that. So that, it's not necessarily a lack of willingness on the part of social workers to do that. It's a lack of access to those very important documentation. They were also reported that they were less likely to have had all of their questions answered and be happy with comprehension of those answers, 40% versus 52% as the average. And last but not least, people with mental health problems, lived experience of mental health problems, were less likely to have had all 4 options discussed with them than any other population group we analysed, with only 35% of people saying that they'd had everything and discussed, and a knock-on effect in terms of actually who made the final decision. Did people feel they made their own decision? Was it made in conjunction with family and friends? Was it made by social work? Was it made by another party than the person in question accessing support? So lots of challenges for delivery of service and lots of areas for improvement, as well as examples of good practice, I should say. This is something of a whistle stop. So that's the sort of flavour of some of the material in there. Go forth and read more. And in terms of project outputs, if I can move to the next slide, We have a range of reports that I've outlined, each of which features a fairly chunky list of recommendations that range from quite specific and small, such as publishing equalities impact assessments on websites and updating sort of information available on public-facing websites, to much bigger ones that engage with the sort of challenges of the Feely report and some of the overlaps with sort of bigger policy decisions that have to be happening at a national level. Mentioned the feedback sessions involving stakeholders, but also this research is feeding in very much to our manifesto work, the campaign work we do with a range of political parties, and our campaigning to engage them, and our wider policy work across the Alliance as a whole, covering both health and social care, because they're not separate. It's an integrated system, at least in theory, and certainly in terms of people's experience, it's interconnected. And we've had a range of events that we've run on this, focusing a lot on the thematics and on those specific population groups, but also looking at the broader picture. Again, that's something that we've had a range of partners involved in, including inviting, although not naming, the people who've been involved in contributing to the research when we're doing local sessions. And if I can move on to the next slide. Thanks. To give a sense of how some of this has informed policy and practice. The My Sport, My Choice was used in the independent review of adult social care. It's quoted at several points in Feely, both in terms of the stats work and some of the intersectional material, but also in terms of those sort of wider trends that we're finding and reporting on. It's influenced the Social Work Scotland standards, the new standards for good delivery of SDS, and we're now part of some of the working groups, working with partners there as they're implementing their new standards and trialling them. We've been working on workshops with the people leading social SDS teams on all of the local authorities across Scotland via the SDS Leads group, and doing sort of work on transparency, good communication, all sorts of sort of key topics on by invitation. And we're also hoping to inform, and in the process of discussions to inform various local authority and health and social care partnerships, so SDS strategic plans. And again, that's linked in with the feedback sessions. We've also got ongoing lobbying work of government and parliament, particularly with the looming challenge that shall be the legislation on the National Care Service, as well as the reform of adult social care. And Lucy and I also contributed a chapter, which didn't explicitly draw on My Sport, My Choice so much, but is very much chiming with the findings of it within poverty in Scotland, towards a Scotland 2030 with no poverty. I might have butchered that title slightly, but there's a link. It's available to download free from CPAC, thanks to their sponsorship now. Lots of good material there on human rights approaches as well, just as a plug for human rights. Yeah, so there's a whole range of areas in which we've been using this research and will continue to do so. And I think part of that has really stemmed from the extensive nature of that early partnership working to develop it, and where that leaves you with avenues for big and small points of engagement. And I'm looking at Lucy to see if I've forgotten anything. Grand. Okay, well, you've had quite a lot of chat from us, so I'm going to ask to go to the final slide, which is thank you, and here are our contact details. If you have any further queries that don't get covered in this, or you want to hit us up for more information, you're very welcome to get in touch with Lucy and I. We'd love to hear from you. And the My Sport, My Choice reports are available at the bit.ly link at the bottom of the slide, or by Googling My Sport, My Choice, because by this point, we've stuck a lot of stuff on the internet. Thank you very much for your time.